give us some data because COVID just happened suddenly to all of us. Nobody was really ready or prepared for it. And so it dawned on me that there should be a conversation about people that actually create this campaign, people who are not exactly scientists. So that was what led to my research in Philadelphia, which is still ongoing, and hopefully I finish this work next year. So please just pardon me in case you see some things that are not totally finished. It's an ongoing project. So I just go ahead and share with you how can we move people to empathy and action in health communications, especially in cases of emergencies. Things are happening and we need to communicate so quickly. So this is. Can you tell me how to move this? I have never used Google Meet before. Okay.
I think okay. All right. Oh, you just
Okay. Okay. I think that. Okay. I just got it. Okay. So these are some campaigns that have been done in the past. Like this is from the UK. This is about cholera. I'm sure most of us know at least something about cholera somewhere. Imagine this was a poster that was released in the UK. This was the headline: Cholera and Water, Board of Works. This was not coming from just some group of scientists, it was coming from the government. And if you look at the down part of that poster, you will see the clerk of the board. That was sent from the clerk. Um, let's look at another poster. This was another poster that was done also from the UK, which was about domestic violence and also about women, about contraception, about family planning. And so this was well received. In fact, this campaign was so well received that they just renewed the campaign last year when the United States are talking about banning abortion and all of that. So some of you might have noticed this campaign somewhere. So what we need to do really is we want to move people from the red part to the blue part. We want to move people from unknown to known. We want to move people from apathy to empathy. We want to move people from not taking any action to taking action. How do we do that? How do we move people in our campaign, as storytellers? So I also look at some COVID-19 campaigns that I happen to know some of the people who created them. This is from NHS from the UK, and that is from the CDC. And then there's this one from New Zealand, which is talking about, be kind and all of that. So who are the actors here? Who are the people involved in this campaign? Now, this is very important for those of us who are involved in health communication. Many a time we do not understand all the stakeholders that are involved. It's not the same as advertising when you're in the ad agency or in the ad environment. It's totally a different, different ball game. So I created a framework which we call the S4 to identify all the stakeholders that are involved in creating campaign, especially when we talk about creating an empathic campaign. So there are four type of people involved in creating this campaign, and not all the time that they work together. There's sometimes friction between these people. There's some tension. So the first set of people I call the S1. I will explain in a bit. The S2, the S3, and the S4. And then there is another S up in the blue, which I call the silent S. These are people you don't see. They're kind of really having influence over your campaign. It is important for those of us who are communicators in this on this call to always bear in mind that these people, all of these people I'm talking about, they have a stake in every campaign that we need to create. They are very important. Let's break them down one by one. So the S1 is, I call this standing at the state. This is the state, the government. It could be the governor of Lagos State. It could be the mayor of New York, whatever country you're in. The state has a stake, sometimes in public health campaign, and even in pharmaceuticals. Sometimes they regulate what new pharmaceuticals have to say, and so it's important for us to understand the role of the state. How does the state come into this campaign? What is their worldview? So when people say a campaign is not empathic, when they say a public health or a health communication material is not relevant to people, I always ask, who are the actors involved? Is the state involved? If the state is involved, like the governor or the president, you're going to hear their voice in that campaign in a subtle way. You would hear it, So it's important to understand what is the belief system of the state? What is their worldview? How do they see this very disease? So we're talking about malaria. What is the worldview of the state about malaria? Tinubu is the president of Nigeria, for instance, and his team. What do they think about malaria? If you don't know what they think about malaria, it might be difficult for you to create a campaign that resonates down the line. So when we were doing COVID campaign, it was important for us to balance, the worldview of President Donald Trump and the worldview of the governor of Maryland, where I was working, and the mayor of the city. All of these people, they had different worldview. And it was really a lot of tension to be able to balance this worldview together. So I will not go in detail about this. I just move on to the next stakeholder. The next stakeholder I call Scala, the scientists. The scientists, I call the S2 in my research, they are usually, they want to play behind the scene. They don't want to really be involved so much in like communicating what is going on. Unfortunately, they are the trusted people. They are the people that we trust to give us something about what's going on. During the COVID campaign, we had Anthony Fauci. Anthony Fauci was always on TV with the president to talk about what was going on. And those of us who were the creative, we were in the room and we were always wondering what Anthony Fauci was going to say next. But we must emphasize that people don't always trust scientists because we have had history of science getting it wrong many times. And for those of you who work for pharmaceuticals in this call, it's important for you to realize that it's not every time that science speaks that we always listen. Science is not always correct. Sometimes they're just learning about something or something new. Is just like COVID-19 was a new kind of virus, so they were just learning about it. So they told us, for instance, they said we should tell people to wear cloth mask. That cloth mask was good. And about 2 weeks after, they told us, no, we need to tell people to wear another kind of mask that was approved. And so people started losing their confidence in science. And this is a worldwide phenomenon for us to understand that. So the third S here is what I call Stella, the storyteller. And I'm sure this is where most of us on this call somehow belong. I'm not making a blanket statement. I'm not sure. I'm not saying everybody here is a storyteller, but I'm sure that maybe some of us, came for this seminar because that is what we do. We tell story, and our job is to create magic. We're in the middle of all of these people. We're in the middle of the state. We're in the middle of science. Our job is to make their complex ideas understandable for people. This is really hard. This is hard, folks, because you need to balance all of these people's worldview as you are in this call or in this very process. Yeah, you need to create magic. So the third person here is the fourth person here is a society. Society is the people that we want to reach, we want to talk to, we want to speak with. Don't forget that we're living in the age of technology. Society is not what it used to be. Society is no longer the passive audience that used to have, the state will talk to you, like the first poster I showed to you when we started. You saw the poster from the UK about cholera. They just told people, boil your water, drink your water that is boiled. It was very direct, top down. Now we're living in a society where people can make their own posters. With AI, people can go online and they can just make posters and disseminate information about health. And that's what happened during COVID. People created their own campaign. Many of them were lies, many of them were disinformation, many of them were misinformation. And so this is a problem that we face in this generation. For those of us who are communicators, we face a generation that can design their own campaign. They can design their own story. And so you really, up to this challenge, how are you going to talk to people? How are you going to make them to understand that they needed to wear a mask or to do something like that? It is a lot of work for the magician. It's a lot of work for the storyteller. To balance all of this S, it's going to be a lot of work. So what do you have in your toolbox? So I'm going to look at one or two posters quickly to look at what people use in their toolbox to balance this, and then we just move on from there. So this is a campaign from the UK. The storyteller was trying to balance everything. You can see in yellow, I highlighted the government, which is the government of UK itself. And then I highlighted the NHS, which is the health board, more like the Ministry of Health in the UK. These are two different, priorities or different stakeholders. They're supposed to work together, but sometimes they do not work together. One is very political, the other is supposed not to be political, right? And then if you have these two logos on a poster, as a storyteller, what kind of message are you sending out? Don't forget that people don't trust the government all the time. People don't trust science all the time. So in some of the research we just carried out, in Dakota, in America, we realized that some people prefer posters, health posters that do not carry the government logo because they do not trust the government. So what we have done, some of the campaign we did in 2020, we removed the CDC logo from this campaign and we asked the state to put their own, or the local government or the council, because we're living in a polarized world. We're living in a world that is divided and people just don't want to talk to each other. I don't know the answer. We're talking about empathy here. So these logos here, these two logos we are looking at, it's important to ask yourself as a storyteller, do I need it? Do we need to put these logos here? Do they speak to people? Do people trust these people enough to have this logo here? And then let's look at the word jab. The jab protects your teen and your family. That's the headline that was chosen by the storyteller. Why did they use the word jab instead of the word vaccine? It was a vaccine, and then they used the word jab. Don't forget that it was the time that we were having, the whole world was experiencing, anti-vaccine kind of sentiments. And so a lot of storytellers were asking, do we need to remove the word vaccine from our campaign, from our story, so that we can appeal to people? So these are questions that you need to ask. I don't have answers for this. Like I told you at the beginning of this conversation, this is a research project that I'm working on with a few people in about 6 different countries. So we're looking at the choices that storytellers have to make, to appeal to people. So using the word jab instead of vaccine, what effect does that have on people? These are considerations for you as a storyteller to make. There's a campaign I missed. I know I'm running out of time. I want to make sure the next speaker is able to speak quickly. Now look at this campaign. Look at the choices the storyteller made here. They made the choice of a love mark. And this is very strange. Most health campaigns during emergency, they like to speak direct, do this, do that. Nobody uses all this emotion and what have you. But this is from New Zealand. And I'm going to talk about New Zealand very quickly. They used the love mark, to design their COVID-19 campaign. And then this is from America, where I was at this time. And we use the face of a girl, and we make sure the girl is looking at the viewer, at the audience, and it was deliberate to turn that head straight to look at the audience. It's important, that it's making a demand of kind of emotional connection with people. And look at the CDC logo also there. Is it important? Is it necessary? These are questions we need to ask as researchers, if we need to put it there. If we don't put it there, maybe people are not going to trust the campaign. These are questions that we need to ask ourselves. So the question that you would ask me is, where is empathy in all of this? So the framework is called S4E. So I have described all the S, the states, the scientists, and all of that. So now, where is E? The E here is empathy. Where does it show up in all of this? This is what we suggest. So E shows up everywhere. E shows up from the state to science to storyteller and society. E is not just something that shows up in a poster. So I always smile when people say they want to design empathy. No, you don't design empathy. Empathy should be part of the process from beginning. If the president, if your state government do not believe in COVID, like in Brazil, the case study of Brazil, is going to show up in the poster that you are going to design. If your scientists do not respect human rights, it's going to show up the way you design your poster. So it's very important for us to understand that empathy is not the end product of your design. It is part and parcel of it from beginning of all the people involved in designing the campaign. So let's talk about Jacinda from New Zealand before I close this. This was the president or prime minister of New Zealand. And I'm sure most of you know that New Zealand campaign, this campaign here, was built on empathy. I already mentioned the campaign area. I don't want to go back. It was built on empathy. Let me see if I can scroll back quickly. Yes. Um, this was a philosophy of Miss Arden. She believed in kindness. She believed that people should have empathy for each other. That belief system was what transpired to the storyteller. It was what designed all of this. So it's important for us to ask, who are the people whose voices, whose worldview are we going to go along with? If your president or your governor or your state people, they do not believe in the right for women, it's going to show up in the way you design campaign for infectious disease. It's going to show up the way you address women. It's going to show up the way you address tribal issue in your campaign. And that is why I'm going to end with this. How do we move people to empathy? I say 5 things to take away. Number 1, the next generation of health communicators need to work across all the S, the states, the science. This is not time for us to put ourselves in a box anymore. We cannot sit down at the end part of the process thinking we can design a poster or a television campaign. We need to understand the state. We need to work with the state from beginning to let them see, to see differently. We need to change, their mindset. Number 2 is we need to work to change the system, not the audience. So people say we need to change people. We don't change people. We change ourselves. We change the way we see the world. We need to change how we see women. We need to change how we see children. We need to change how we see Hausa, Igbo, Yorubas, and all of that. It's very important because if we do not, it's going to show up in our poster, in our design. Then we need to know that empathy is not just being in other people's shoe. It's about doing something about it. It's not just seeing that people are suffering. We have a medicine that will solve it. What are you doing about it? So don't tell me you're just a communicator and you're not participating in voting. You're not politically minded. You need to be a human rights activist, even as a designer, to understand that you're not just designing just for people, but you're doing something about their problem. So all of these are things. And finally, we need to approach our subject with humility. What does that mean? It means that we don't have all the answers. COVID-19 taught us that. Every directive from the government and scientists, they were changing every other week. And so we were looking like liars. When we told people something last week, we're going to change it the following week. So what that means is that as designers, we need to approach our subject with humility. We don't need to always have a final say. We need to say that this is an update, it might change, and all of that. So based on all of this, I just want to say thank you for listening. I'm sorry I was rushing because I'm really thinking about the next speaker, and I don't want to just bore you with all the details of the research. But I have told you about the 4 type of people that are really involved in designing, an empathic campaign: the states, the scientists, the storyteller, and society. And it's good that all of these people work together to create a campaign for everybody. Thank you very much.
Thank you so much, Mr. Kehinde. That was a very, very detailed presentation. I have my notes here. I have dropped a lot of I have questions. I should start with that. But then we're taking questions at the end of all the presentations. I have my notes. I've written 2 pages already, and I'm waiting for the conversation. So let's go to the next speaker. I want to believe Ms. Chioma is ready for us. Ms. Chioma is going to be talking about the power of healthcare communication. And please, if you have colleagues that would benefit, if they would benefit from this webinar, please do share the link with them. Um, Also drop your questions on the chat box so that we'll be addressing them at the end of all the presentations. And then let's also get to know each other, introduce yourself, where you're from, and so that we can have a very interactive section. So, Ms. Chioma, over to you, ma'am.
All right, thank you so much, Boluwatife. Thank you for that presentation. I hope you can all hear me. And to Mr. Kehinde, thank you also for that very detailed and insightful presentation. We are aligned on a number of the sentiments that you hold on your presentation. My name is Chioma, Enwereji-Ogbonda. You can call me Chioma, you can call me Mrs. CEO, anyone that works for you. And this is a very interesting place to be at. Normally, when I'm at webinars or events of this nature, I'm usually on the other side moderating or being an MC. And so being a speaker is a very interesting shift for me. However, it's exciting. I've been tasked with speaking on the power of communication in healthcare. I don't have a presentation to display like my amazing speaker did, but I will do well to keep you as engaged as I can. I would also share my presentation after we're done with the webinar. It's a bit like they'll say in today's palace, it's not given. So I wanted to give, and that's why I'm not going to present it just yet. Okay, I would just try to give a little bit of I'm going to try and make it as practical as I can and keep it as relatable as I can. I imagine that a lot of us who are here today are budding communications personnel or specialists or experts, or you have interest and you're just looking for how you can find your way and make your mark or make some kind of influence in the space. I think we can start with a bit of a definition. I think that helps with the conversation going forward. I have 20 minutes. I'll try to keep that a little under 15 minutes. First of all, let's start with what is health and why should health matter? Because we're talking about the power of communications in healthcare. So the crux of the matter is there's health there at the center of the conversation. One of the things that I would say is health does not mean the absence of disease or infirmity. You know, it's not enough to say that because a person is not experiencing any kind of discomfort or disability, that means that they don't have any issues with their health. Health at the core of it is an element in people's well-being and happiness. It's a core element in people's well-being and happiness. It's an important enabler and a prerequisite for a person's ability to reach his or her goals. Now, having established that, healthcare communication or health communication, on the other hand, it has been a part of development communication for a very, very long time. We've seen over time, if you want to check the history of communication, you know, go through all of those theories and sciences, you'll find that from when people start introducing things around family planning, things about even what my speaker spoke about earlier, you know, family planning, things around chronic illnesses such as obesity, even with smoking situation, HIV and AIDS and things like that. You see, even with when you had the earlier pandemics of the cholera, of the polio, you know, you start having systemic and systematic communication targeted at a particular audience with a particular message, with a hope to get a particular outcome. So healthcare communication has been on for a really long time, and only now we're sort of seeing a little more complexities to it because, again, like Kehinde said, with the introduction of new media platforms, people are able to sort of be on the proprietary end of media as opposed to being on the receiving end of media like it was decades ago. And so I'm going to try to highlight a little bit of some of the importance of driving behavioral change for a better health outcome, right? Behavioral change is pretty much about interpersonal communications on the health literacy, on health control, management, disease prevention, food nutrition, and so many other things that impact the individual. Behavioral change, we often find that it is essential in managing chronic diseases, in encouraging preventive measures, and also promoting healthy lifestyle. So there's certain communication strategies that you want to employ in utilizing the power of communication by itself. If I wanted to backtrack a little bit, sometimes you see people, maybe two friends who have a disagreement, and the person says, "Oh, but I tried communicating with her." Or let's say if you with your HR, for example, you say, "I've tried communicating with so and so person," but the question would be, did they receive your communication? Did they understand your communication? And one of the ways that you can verify or affirm that a person or that your communication has reached the end user and they properly understood it is that you get a level of feedback, right? And in this particular context of our topic, the feedback we want to see is a behavioral change. So we want to see how we have leveraged communication to bring about a transformative change on the end user of that particular communication. And so there are certain strategies that you would want to engage. This refers to specific methods or approaches that you've designed to influence and to alter the patient's behavior in a positive manner, obviously. And these strategies would include motivational interviewing, it could include health education campaigns, personalized communication, and leveraging technologies such as the mobile health apps that you have, right? Including things like the telehealth. The part of the communication or power of communication also underscores the transformative impact and the effective communication that it can have on healthcare outcomes. Well-crafted communication can empower patients, it can improve health literacy, and foster a better patient-provider relationship. So some of the other importance that you have when you utilize the power of communication is that you see, okay, we'll get to your questions later. You see that there is when you have a clear patient engagement and empowerment. So that means that you're providing a very clear and empathetic communication to your patients. This will then empower them to take charge of their health. Another very key importance of the power of communication in healthcare is that it helps to build trust. So when you apply thoughtful communication that improves the knowledge of a patient, it would build trust. We've seen that play out in different areas. I'll give you a very recent scenario that's happened where I work at Evercare Hospital. We recently introduced a health intervention for people with hearing impairments, the people who you refer to as those in the deaf community. And it was a very thorough, a very state-of-the-art intervention, a very, very interesting surgery for children who prior to that particular time had never heard any kind of sound from their ear. And of course, when a parent enlists their child into such a program, they have concerns, they have fears, they have anxiety about the process of the surgery, about the outcome of the surgery. And so that's one of the ways that you leverage the power of communication is, first of all, in letting them know that they can come into your facility, that you offer this kind of service. Another way is to build a level of trust. And one way you do that is to simplify the process for them. You want to let them know this is what's going to happen from end to end. When you start, when you come in, we are going to do this, we're going to do that, we're going to do this, we're going to do that. And you're doing this not with using wild medical terminologies, but you're using very simple terms. And what that does is to build a level of trust. And another thing you want to do, what we did was to introduce the people, the surgical team, introduce them, because what we found prior to this time was when surgeries like this want to happen, you don't even meet with the medical person or the medical team. Most times you're already in the theater and they just start operating on you, like is when you've probably come on the other side and you're when they're having the post consultation. But what with this kind of case, you want to be able to introduce the team and just build a level of trust so that the patients can ask questions to the doctor can provide answers to the patients as well. So that's one of the importance of the power of healthcare. It helps to build trust in your patients. That way they can know that they are in good hands, within your facilities. Some of the strategies that you can employ to have an effective healthcare communication to keep it sustainable is to first understand the personal and the contextual way of your communication, which I had earlier mentioned. Secondly, you want to also understand the differences and the similarities between the cultures. Now, it's one thing to, it's not enough to just say, oh, I've communicated. Using Nigeria's landscape as an example, we find that the communication that works for the people up in the north is not the same kind of communication that would work here in the south, or this communication that you direct at, say, the Islamic population is not the same that you direct at the Christian population, and vice versa. And so you want to be able to understand the cultural nuances, within your target audience when you are deploying any kind of communication across any kind of platform. Thirdly, you also want to understand the history and the past understanding. Knowing the history of the people that you relate with, it would help you to assess the situation and know the best tactic or the best strategy to employ. This you can see when Nigeria wanted to go on the population census. There were feedback that in certain areas of the country, they were not receptive to the idea of being counted, right? However, in other parts of the country, they didn't see a challenge with it. And so the onus would be on the communications team to go back and see how they can develop messaging that would fit and suit that particular region who is not very open to the initiative, just so that you can have a better headway into it. So I just wanted to highlight a little bit to give us some case studies, to talk about some of the ways that we've seen communication yield a change in the behavior of the people who have received it. Of course, there are certain behavioral change theories that you would want to engage in, but I'm not going to go into all of that. It's just going to be a little too academic. I'm not saying you can't take that, but I don't want to bore us with that. I want to just keep this as practical as possible. We see that on a global level with the HIV and AIDS awareness campaign that has been carried out globally. The UNAIDS, the UNAIDS or UNAIDS, they have run extensive global campaigns to reduce the HIV stigma and to promote safe sex practices, right? And they had to engage the mass media, they had to engage community outreaches, they had to engage educational programs to bring about an increase in awareness and a reduction in HIV transmission. And then, of course, we also have other kind of campaigns, like I said earlier, the anti-smoking campaign. That was one that it really had a very huge impact. Again, when you're communicating, you want to have what your objective is. And for us on this webinar, our objective is to see how we can leverage the power of communication to bring about behavioral change. And we see that with the anti-smoking campaign that was done in the USA. One of the things that they leveraged was to use graphic, really horrific imagery. Kehinde had talked earlier about driving certain emotions, when you are communicating. And so for this one, the emotion they wanted to bring was a sense of awareness on the consumer, to say, if I take this stick of cigarettes and use the cigarette or smoke with the cigarette or whatever other kind of tobacco product it is, these are the impact. This is the impact it will have on my health. And having that visual there is not enough to say smokers are liable to die young, but seeing the visual to say this is what will happen to your internal organs was enough to cause, you could say it was a fear factor or anything, but I think it was some way to also enlighten people. That sense of shock, it was almost necessary to employ that tool. And so that's one of the ways that we have seen some change, in the behavior of people when they had leveraged the power of communication. That campaign recorded a reduction in teen smoking because of that visual communication that was leveraged. Another global campaign that we saw the power of communication play a very key vital role was in the COVID pandemic. Prior to the COVID pandemic, we some of us already had the habit of washing our hands after probably using the toilet, maybe after eating. However, we saw that there was an increase, there was an uptick in the people who understood the importance of washing their hands and understanding that that was one way or one step to prevent them from contracting the COVID, from contracting COVID. I'm sure a lot of us remember the 22nd birthday, happy birthday song, right? So you're washing your hand and you're singing happy birthday, happy birthday. It's very interesting that I catch a lot of people humming the song or humming the happy birthday song when they're washing their hands. And I just smile because for me, it's like that right there is the power of communication. You're able to then realize the importance of it. Bringing it close to where my organization at Evercare Hospital, with the recently concluded hand hygiene day, we rolled out, as part of the campaigns, we rolled out a voice prompt where no matter where you are in the hospital, at random times during the day, you would hear the voice, that says over the speaker, telling you to get up and use a hand sanitizer. And that's because we wanted to maintain a decent outcome in infection. And so we wanted to encourage the habit of keeping your hands clean by either washing it with water or using the hand sanitizer. And so what you find is when that voice prompter goes up within the hospital, people, including staff, including patients who are aware of it, get up, go to the nearest sanitizer dispenser, and they sanitize their hands. And more than that, we also, of course, demonstrated the proper way of washing your hands, either using water and detergent or using just a sanitizer, an alcohol-based sanitizer. Now, bringing it home to Nigeria, one of the other examples where communication played such a key role in bringing about behavioral changes, positive behavioral changes, would be in polio eradication. That's something that I was very pleased. I think it was in 2020 or was it 2021? I'm not sure the particular year, when they recorded almost like the last case of wild polio infection. And I thought like that was just tremendous. Imagine how many years it took over time, going through different campaigns about vaccination, for parents to bring their kids out for vaccination, polio vaccination, for us to get to this point. So that's one very key way that we have seen. Nigeria recorded a significant success in reducing polio cases, and through the use of local languages. Remember I said earlier, you want to be sure that you profile your audience. So it's not enough, yes, we speak English. English is a recognized language in Nigeria, national language in Nigeria. However, we are not ignorant of the fact that a number of the population still stick with speaking their local dialect or understand better in their local dialect. And of course, it would be almost a gross incompetence to ignore that fact. And so developing campaigns in the local language of the populace was also very key. You want to also engage with key stakeholders, and some of these people would include the community holders, the community leaders rather, because of the hierarchical situation we have in Nigeria, where a lot of the populace defer to their community leader. Going through your community leader whenever you have any kind of health campaign is one way to gain major success, and that's what we saw with the polio eradication campaign. And of course, they also engage with mobile health units as well, educating parents about the importance of vaccines and letting them know how crucial it was for the health of their children. And we saw an uptick in that, right? So some of the data that I could find online concerning this was that the survey that was conducted saw that there was over 90% of respondents acknowledging the importance of vaccine by 2018. And then, of course, we also saw a reduction in the cases where the last case of wild polio virus in Nigeria was recorded in August 2016. And by August 2020, Nigeria was declared free of the wild polio virus by the WHO. But of course, there's continuous monitoring and all that. But this is just one way to show you the significant role that the power of communication plays in delivering whatever campaign it is that you have, especially in the healthcare industry. We also have seen similar cases of maternal and health programs where we wanted to reduce the mortality rate, for children and for moms during delivery, during childbirth. And by insistent and consistent communication, there's also been a record of reduction in all of that, by also teaching the healthcare community, the healthcare workers, to imbibe healthy practices as well. So this has also contributed majorly in doing that. I also like to talk about the power of using social media. Yes, traditional media is still there. Yes, the power of community is still there. However, we also see that there is it's a growing increase in new media, social media, what you call it. And that's also one way that that organizations, that government can also leverage to ensure that they use communication rightly. And one of the ways you can start is to ensure that you produce only verified information. You know, most times when there's a news breakout, a number of us will rush to certain accounts because we've come to trust those accounts as being credible. And so that's something that if you are the one in charge of your organization's social media, you want to be sure that whatever information it is you are giving out is credible, is factual, is verified. That way, your audience over time begin to see you as a factual place that they can confirm information about anything. I'm not sure what my time is. Tifa, if you can please just give me a pop-up on the chat so I'm sure how much time I still have left. Another thing that I also want to talk with social media, social media provides an opportunity for you to explore different formats of communicating. So whether it's visual, whether it's audio, whether it's written, there is a platform that you can use to reach your audience. For some people, visual is one way that they receive communication. For others, they want to hear it. For others, they want to have it, demonstrated to them. Oh, time is exhausted. Okay. So yes, the last unfortunate situation we had with the drowning incident, where we then saw a lot more organizations talking about resuscitation, CPR trainings and CPR DIY videos. Those are things that make you understand really that there's so much power, there's so much importance that communication holds in healthcare and in health. And so in conclusion, we have affirmed that communication is a fundamental tool in healthcare for driving behavioral change. We've also seen that effective communication strategies can lead to an improved patient engagement, to better health outcomes, and to more efficient healthcare delivery systems. We've also recognized that communication is not just a means of information exchange, but it's a powerful mechanism for driving meaningful change in patient behavior and health outcomes. So I encourage you to be sure that you outline your strategies first before you just go out to start disseminating. Outline your strategies, outline what a success would look like for you, for your campaign, and you're able to then realize that healthcare communications is just no longer you dropping the information because you're at the top to the downwards, but you also need to be able to listen to what is being said about what you've communicated and make any changes or make any adjustments where you need to. And lastly, we also want to consider that enabling the environment that would influence decision-making process, the attitude and health behavior of the individual is also very, very important. So you want to empower your people that you're communicating with, so that, especially in the healthcare system, so that they're able to know that they don't have to depend on you all the time. If you give them the right information, communicate it in very simple terms. It's as little as how many times they should take their drugs. It's as little as how many times they should wash their hands or when they should wash their hands. It's as simple as telling a new mom the importance of breastfeeding. It's as simple as telling a teenager the importance of safe sex practices. It's as simple as understanding that when you target more information about the health of a family towards the woman, towards the mother of a home, you increase the chances of that family being in better health. So sitting down to put together your strategy and understanding what ways you want to deliver those information strategy is very key in leveraging the power of communication. With these few points of mine, thank you so much for listening.
Thank you so much, Miss Chioma. That was a very enlightening session. I also have notes pen down, and like I said earlier, we'll be taking questions at the end of every presentation. So we'll be moving quickly to Mr. Chibuike. Now, this part is very important for me because when I was working in an organization, I had issues with budgeting. Very little budget allocated to comms, but we want massive turnovers, massive implementation of, want to see big things with the budget that we are assigned to communication. So Mr. Chibuike is going to be talking to us about aligning budget with communication goals and strategies for optimizing budget allocation to prioritize stakeholder engagement rural change initiatives. So Mr. Chibuike, welcome.
Hi everyone. Thank you. Thank you so much. Can you hear me?
Yes, loud and clear, sir.
Okay, yeah, thanks for the opportunity to speak, share a few thoughts, from my experience working with Nigeria Health Watch, which is a health communication and advocacy nonprofit. But beyond, sharing, thanks for the opportunity to learn. It's interesting having to speak after after the amazing presentation from Kehinde and Chioma. But again, it's an opportunity to learn as well from other colleagues and from us as well, the other people in the room. Sorry, initially I just wanted to speak through, but just wanted to share an image, but I was inspired to just put a few slides together. Okay. Can you see my screen now?
Yes, we can see your screen.
Okay, and it's full screen, right?
Yes, it is.
Yes, it is.
Okay. All right. So yeah, so like I said, I'm happy for this opportunity to learn and also share. So when I have the opportunity to make presentations like this, I try to make it interactive, right? But I know we are constrained with time, so I'll just go right into it. I usually like making it engaging so people can also share, because I usually see this as a two-way thing, so more like facilitating, not just putting out. Of course, I understand we have to work with time, just like Kehinde and Chioma try to run through their slides. So, and speaking from, again, it's interesting to speak after they have laid the groundwork, pretty much made the work easy for me, right? Kehinde talked about empathy. You're trying to, beat people's emotions so they can get to act the right way, do what they're supposed to do, moving them from one point to another, like he also said. The same with Chioma, her presentation around why you need to even communicate in the first place, behavioral change and all of that. So I think that essentially sums up why I put up this slide. But in addition, you also want to be able to reach out to stakeholders, right? And interestingly, I mean, like I said, they really make the work easy for me. So Kehinde also talked about the axis, the people that he sort of grouped. So you also want to reach out to stakeholders, both the stakeholders who support you with your work, and in this case could be funders if it's a project that you are implementing, or your investors, or even patients, because most times, especially in the healthcare space, sometimes we don't realize that the patients sometimes are the most important stakeholders, because if they are not there, I mean, who is the doctor going to treat, or who is the nurse going to attend to? So they are all important stakeholders. When you are communicating, you want to carry them along. You want them to understand the message you're trying to pass, right? So I came across this slide some time ago, and I've been keeping it. This was like almost 3 years ago. I came across this, and so when I was given this task, so when Boluwatife told me, I said, okay, maybe this is a good place to also use this, right? Because yes, you are doing something. So in this case, I'll be speaking in terms of maybe projects. Again, back to the example that Boluwatife gave. So you are tasked with something. You are supposed to communicate something for to get to a certain point. So you have a goal for communication, maybe a project in this case. So not in the instance of maybe behavioral change, even at that. So even if it's a project that you are managing and you are supposed to communicate it effectively, at the end of the day, it's still there's still some elements of behavioral change in your communication because, for example, you want your stakeholders or your investor to understand that you delivered this project very well. You use the funds judiciously, right? And you want them to see, the impact of that, to see the outcome of your communication, so that probably if you want to extend the project, they'll be able to fund you again to sustain, that impact. So again, this really it really spoke to me when I saw it. So you're doing the right thing, but next to doing the right thing, the most important thing is to let people know you are doing the right thing, right? So it's not sorry, it seems someone needs to mute, or is it me? I'm hearing some feedback. So it's not bragging. You need to put your work out there, because if you don't, someone can even own the story, right? When you are the one putting in all the hard work. So it's really important that you communicate. You're doing what is right, but people need to know, because if they don't know, those gaps, they can be those gaps can be filled with misinformation. People make up stories. Again, back to what has been said, what Kehinde said about Dr. Anthony Fauci being always on TV during the COVID-19 pandemic. So those were just efforts to ensure, yes, they are doing something, but doing something is not enough, because if people don't know you're doing something, they'll think, oh, they don't even care. They're just sitting there in their houses, in their country houses. You're right. So you need to let them know these are the efforts you are making. If there are issues, if there are mistakes, you own up to the mistakes, communicate honestly, tell them you are working on it. But that's, that ability to put it out there, let people know, is very, very important. Again, this is not a communications class, different. Again, Chioma also mentioned some strategies on how to do it, so I won't dwell on that. But just a quick how. Again, this is me also sharing experience from our work, some of the things we've seen since I joined the organization over 6 years now. But it's really critical, whether it's you leading communication efforts or you're advising your organization, to realize that it shouldn't be an afterthought, right? And we see this a lot. I mean, I work for Nigeria Health Watch, is a health communication and advocacy nonprofit. So we advocate for various issues in the health sector. We put out lots of communication materials on social media, on our website, our editorials, and multimedia content and all. So having been doing that over 15 years now, the organization has been in existence for over 15 years. We've sort of built that capacity that people now engage us. So beyond the one we are doing for ourselves, right? The projects that we are pushing for, the issues that we are advocating for, organizations also engage us, right, to deliver these services to them. And one thing we realize is they take these things sometimes as an afterthought, right? So you are doing a project, you started something 3 years ago or a year ago, you didn't engage, you're just doing it and packing up the data, all of the insights and everything that you're getting from your project. Then on the last day, when you're doing like your project dissemination or project closeout, you're now inviting us. You want us to understand everything that has been happening for the past 3 years. You want us to understand it in less than 3 hours event. You want us to send out tweets. You want us to do a story or a blog or a feature article around it. So that's an afterthought mentality. Why not engage the person, from the get-go, right? Of course, you don't have to engage everybody. If it's, say, you want to work with a media organization or select journalists who are really good with their work, say health journalists, it's not a good approach to try and engage them at the end, right? So this is maybe one message you should take out if you're leading communication efforts. Try to engage from the beginning, and that way you are also building a community. So even if you don't have money, and I'll get to that shortly, because the whole premise of what I'm supposed to talk about is how to do this on budget, right? So, but the good thing with engaging people from the beginning is they don't see you as, and again, it also doesn't push this concept of brown envelope journalism, because you invite them. For that, I'm just using journalists as an example, because there are so many strategies that you can put messages out there. But so imagine you're engaging journalists when you're doing a dissemination. Yes, they come, they attend your event, you give them money or transport or what, whatever it is tagged, and you expect them to do a story, and that's it. Everybody moves on, right? It's not. It doesn't help the project. It doesn't help the agenda you're trying to push. It doesn't help the issue that you're trying to push. The message you're trying to push, and the journalists just see it as a business. It's a business transaction. It's just that transactional, right? So, but if you are engaging them from the beginning, they are part of your community. They trust you, even when they need experts to talk to, because you've now positioned yourself as a leader, as a thought leader in that space. They can reach out to you. And remember, this is an opportunity. So reaching out to you now, they are talking of, say, oh, this is the person we talked to. This is who they are. This is the organization. It's also airtime for you. It's also visibility for you. So these are really strategic ways to do it, even if you're low on budget. But how does it happen? Not treating it as an afterthought, right? And again, that leads into the next thing, leveraging networks. Again, networks is not something that happens one-off or over time, or just suddenly. It's built. It's a relationship. So by the time you have that network, you nurture it, you maintain it, you sustain it. You can even get a few things. Of course, they're also running businesses, so you don't expect them to be doing free things all the time. But the fact that you have that network, you can easily leverage them to push out your communication out there, to push out your messaging or your campaigns out there. And my organization, there's this concept we've been not pioneering per se, but we've been pushing for the practice in Nigeria. Whenever we talk about communication, we always find a way to, encourage people to try and infuse it. So, approaching your communication with the solutions mindset. So it's this concept of solutions journalism, right? Because of course we know how the media space is. It's always problems in our faces. There are issues everywhere. Quite all right. Of course, we can't ignore the issues, right? So, but if you're now going to be telling stories, it's important to tell those stories from this concept of solution journalism, and that's basically sharing what is working in the society. How are you doing it? So you as a comms person or as a comms lead, you sometimes you have the PR mentality. Oh, we want to just get it out there that this is the amazing thing that we are doing, right? Which is good. But if you're going with the solutions mindset, because it has pillars that guide it, 4 important pillars, you're going with the mentality of how do I tell people what I'm doing, but how do I make sure that they are learning from what we are doing? So what insight from what we are doing can help them, right? So imagine they're having similar problems. They can now, try to replicate what we are doing, or even reach out to us. We can partner to expand what we're doing to, to their own context or to their own space. So that's a sort of changing that, that focus on problems. Yes, the problems will always be there, and we have to talk about them. Quite all right. We're not saying ignore them, but this is just a way to create a balance. So we're talking about problems, but we're also talking about what we are doing to address those problems. Again, it's not a solution journalism training, but just know there is a thing like that, right? So you can use that approach in putting out your messages. So rather than saying, oh, we did this campaign on, say what, which example will I use now? So we did this campaign, we reached 5,000 people. It was all amazing, right? That's sort of a PR mentality. But if you're going with a solutions mentality, you're saying, oh, here is a problem. Maybe, maybe World Mental Health Day, people don't have access to mental health care. It's not often talked about. You've talked about it, but this is what we did to address that problem. But how did we do it? You see that you're now shifting from the usual, oh, we did it, we did this, we impacted how many. How did we do it? We worked with a couple of doctors, we got their buy-in. So you're already laying down your processes so someone can learn from what you did. So you can now go ahead and talk about your impact. So after doing this is what we achieved. This is how we're able to do it. If possible, even tell stories of people that impacted, because that way you're also putting your evidence can be qualitative or quantitative. So qualitative in terms of people's stories. How did what you did, how did what that thing you did or that intervention, how did it impact their lives? So you tell those stories, you share some insight. What can others learn from what you did? What were the limitations? So these are like the pillars I talked about. What are the limitations or challenges? So you see, you're telling a holistic story that others can learn from. So if it's an organization, another organization can learn from what you guys did, and they can try to replicate it in their own spaces, right? And finally, so think of what you have already. Yes, you're working on budgets, but what do you have? You know, like they say in the Bible, for those of us who are Christians, when God told Moses, what do you have in your hands already? You know, hit it there and water will come out. What do you have? It's not enough to say, oh, we don't have money, I'm doing this on budget. What can you do? Canva creates amazing graphics these days. Get someone can learn how to make really amazing graphics with Canva. You can put out your campaigns. You don't need to work with a graphic designer to do it. Newsletters, you can get your messaging out there. If journalists refuse to publish your this because you don't have money, you can create newsletters. There are free newsletter platforms, Medium, Substack, and the rest of them, Blogspots, even LinkedIn, you know, where professionals are, to create a newsletter there and put out your content. And of course, social media that Chioma also talked about. So these are ways, in addition to what has already been said, that can help you do this. But doing it on budget, well, I think first things first, realizing that nothing good comes cheap. I mean, if you want to hire the likes of Chioma or Dr. Kehinde to work for you now, I'm sure their bills will not be, will not be cheap, right? So yes, we're talking about how to do it on budget, but also I think the first realization should be these things are not cheap. Good work is not cheap. You know, good soup, it's money, now money killer, like we say in Nigeria. So that realization is very important, for your team to even know that. Again, also back to what I said before, let them not see it as an afterthought, right? But importantly, you also need to now be clear on your goal. And again, I wouldn't dwell too much on this. Chioma talked about it. What are your objectives? What do you want to achieve with this communication, or what you're trying to put out there? Because by the time you do that, it will now help you to sort of know how to manage your resources, or the low-hanging fruits, right? The ones you can do without even money. But if you're not clear, we just want to communicate, it will look too big. By the time you break it down, know exactly what you want to achieve, what is the goal, what is the outcome, what do you want people to do, what change do you want to see after you communicate or people get your message. Now it'll be easy to know how to manage your resources. And again, this concept of, I picked up this thing from someone, resources versus resourcefulness, right? So it's good that since we are talking of budget now, doing something on budget, not too much money, it's good to be resourceful. Yes, you may not have all the resources, but once you are a very resourceful person, you see that you can even achieve more than the person that has the money, but they're not very resourceful, they don't know how to use it very well. So that's where you also need to be clear, or something you have to think through, how to be more resourceful. How is it network you need to leverage? Is it contact? Is it tools that you already have access to? That is being resourceful, and it's very helpful when you're trying to work on budget. So yeah, that's it. I'll just share an example just from my own experience too. So this, like I said earlier, we are pushing for this practice of solution journalism in the country, letting journalists know that, look, beyond all the problems that we all face, you can tell stories of what's working as well. So we've been doing it as a practice. So we do tell solution stories as part of our health communication and advocacy work, but doing that over time, we now got a grant in 2020 to help spread the practice in the country. So the project is called Solution Journalism Africa Initiative. It's happening in Nigeria and in Kenya, but we are the organization implementing in Nigeria. And the objective or the goal was quite simple. Train journalists, media organizations, support them to do solution studies, because of course you learn by doing. So the idea was not to do a one-off training, you just do a training and you move on. We train them and we support them over a period of time to inculcate it into their practice. So it ran for 3 years. So that was, and I was the project lead on the grant or the project. So yes, we had our objective, but I also knew that it's important to get our messages out there, right? Back to that first slide I shared, next thing to doing good work is letting people know. So I thought, of course, we are an advocacy and communication organization, so it would make sense that we're doing something that nobody even knows about it. So from the beginning, right? Again, back to what I said, when I started, not as an afterthought. So it's not, it wasn't when the project, and they were like, oh, how can we get this thing out there? From the beginning, we decided we're going to be, what's the word now? We're going to be, sorry, but if my time is off, please, you can jump off my, I'll soon be rounding off anyway. It's just this case study or example around. But if my time, because I can't see my chat because of the full screen, so you can just get off mic to tell me how much time I have if you need to remind me. Um, so yeah, but I'll soon round up. So we also knew that we needed to, really put the messaging out there from the beginning, right? And the goal was quite simple. I mean, we needed more people to know, both creators in this sense now, journalists, media organizations and all, and also consumers, because we also wanted the audiences to realize that, look, there's a thing called solution journalism, and beyond all of the bad news and all of the issues that we see, you can also demand for, more wholesome storytelling, not just focus on issues all the time. So wanted her to know that there's that concept of sojo or solution journalism. And again, leveraging, so there was no budget at all. Actually, there was no budget for communication. The project was focused on train journalists, support them, give them some mini grants, and support them to do solution stories. So there was no budget for comms actually, right? But again, we're a comms organization, so it will make sense that we're doing something that is not even out there. But what did we do? We leveraged all our networks, and we had radio engagement, surprisingly. That might surprise you. We had radio engagements that we didn't pay for. Why? Because we leveraged our network. Of course, we are big on social media, so we put out content actively, did short videos, interviewed people that we're working with, organized Twitter spaces, and all of these things, created visibility. It was dropping on people's timelines, and we even, interestingly, so we now created a unique hashtag from the beginning of this. So we had a hashtag that we created. So anything that we put out on social media, especially Twitter, because Twitter is big on hashtag, but even other platforms, we use that hashtag so that we'll be able to track at the end of the day. And what did that lead to? Even unintended media features, things we didn't plan for happened. We were featured on writers. Why? Because they were seeing in all of the things we are putting out on social media to say we are doing this. So when they were doing stories around, oh, this is how an organization is helping journalists, integrate solution journalism into their practice, they reach out to us to interview us. So we got all those features, IJNet, and that sort of now positioned us as thought leaders in that space. So anything solution journalism in Nigeria, even on the continent, we always called upon. We've been called upon to support trainings in other countries as well, speaking at events and conferences. Why? Because we are very deliberate about putting out messaging about the project from the get-go. And this is just a snapshot. I think this should be my last slide. A snapshot of, so when the project ended last year, it ended officially last year, but again, when you do good work, the reward for good work or the hard work, how do they say it? It's always more work. So it's been extended for another 18 months now. So this was when the first phase ended, and we did like an analysis of the hashtag. So this is the hashtag I mentioned that we created. And my colleagues did an analysis of the hashtag to see how it performed. Of course, some of the metrics here are, like they say, some vanity metrics, but there are some still useful insights from this. The potential reach, the potential impact, see reach of 4 million, to potential people who contributed, 424 people. So different people who wouldn't have contributed if we were not, deliberate about putting out information out there. So yeah, that's some of the insights I wanted to share on how to do this. And as far as budgeting goes, so I think just to summarize, so when you are now clear on this, you can now know what to prioritize. When when you are clear on what you want to achieve, you can now say, okay, maybe the small money we have, we can use it this way, right? But again, back to, it's important to be more resourceful. It's about being resourceful than just about resources. So yeah, on that note, I'll be ending. Thank you. I hope I did not spend too much time.
Thank you so much, Mr. Chibuike. Thank you so much for Mr. Chibuike. You answered a lot of questions that I had prior to this presentation. So before now, when I sent Mr. Chibuike the topic, he asked me what was my expectations or all of my expectations, and then I told him my story. and the slide. I'm not sure I'll be able to answer all of that question, but I'm sure I'll be able to put it together. And well, my questions or my pain points have been addressed. So now we'll be moving straight to the questions. We spent no time, so we'll be moving straight to the questions. Two people have dropped their questions, so I'll start with Mr. Jesu Joba. And it says that his question will be from the angle of healthcare as a business. In this context, the communication is a lot more inclined towards marketing objectives. Sometimes the KPIs here can be a little more aggressive. How do you recommend applying this framework to that context? I know Mrs. Chioma also is also in the healthcare business angle, so I think I will want to push that to her. And Mr. Kehinde has also dropped a response on the chat box. Well, let's also hear from Ms. Chioma, and then if Mr. Chibuike wants to add one or two things, we'll hear from her.
All right, thank you so much for the question. I would come at it because from the angle of being a client, as I'm on the client side, so I don't run my own business. I'm an employee, right? So the question says, in this context, the communication is a lot more inclined towards marketing objectives. Sometimes the KPIs can be a little aggressive. How do you recommend applying this framework? So I suppose she's referring to a framework that Kehinde had presented, right?
Yes.
Okay, I think okay. All right.
Okay, so maybe if you can expand a little on that framework, it will help me really respond to your question correctly.
Okay, so maybe so that for sake of time, I don't drag it. I think Kenny dropped a response. Usually, marketing objectives are get money, get profit, especially from the business angle. So healthcare as a business, if you're running a hospital that needs to make profit, if you're running a healthcare company that needs to make profit, your communication is not just empathy. It's not just, yes, I get there's the empathetic component to it, but there has to be the calls to action, the get people to buy component to it as well. So that's what I was asking.
Right. Oh, absolutely, absolutely. You, if you're in the hospital business, you are indirectly responsible for a percentage of uptake in the services and the products that the hospital is providing. So yes, your communication is not just to say, "Oh, we love you so much. Take care of yourself. Cover your nose, go with an umbrella when it's raining," that kind of thing. You're also saying, please come into our facility. We have XYZ and we're going to take care of you in XYZ way. So yes, your KPIs are completely different. And yes, it's going to be a little aggressive. I won't want to say aggressive. I'll say more of consistent. It's going to be very consistent. You want to be in their face. You want to be the Maggie of the healthcare industry. You want to be the Omo of the healthcare industry. You want to be the name that they say, "Oh, I'm going to a hospital." So rather than saying I'm going to a hospital, they'll say I'm going to Evercare, and that would mean I'm going to a hospital. Do you get what I mean? So it's you then breaking down what the services you have are, and you can categorize this in different ways. You can do thought leadership. I think that's a huge gap in, forgive my second audience here. That's a huge gap in the healthcare industry, is the thought leadership that you have. So you want to leverage on the medical expertise of your doctors, of your nurses, of the consultants that you have. Because like my director of operations would always say, without the doctors in the hospital, we're pretty much running a hotel. So that's one area you want to emphasize. You also want to emphasize, maybe it's your facility. Maybe there's something amazing about the facility where you're running and operating your business from. Probably you have certain amenities that are not very prevalent in other facilities. You might also want to leverage on that. You also want to leverage on, of course, the testimonials, referrals of your current patients, right? Because that's usually where you get more of your business. The people who have already engaged with your marketing before. And another thing you also want to position yourself is, as like I said, be factual, put out verifiable news. So there are a lot of myths around the healthcare sector, around health, around diseases and ailments that people have. So you can focus on the area of giving well-informed, detailed information, and so you be the person that they come to when they need certain information about something. But at the same time, every communication you do, and I say this to my team, every communication we do has to have a call to action, which is at the end of the day, we want you to walk into the hospital, we want you to engage our services, we want you to refer someone, and then we also want you to be a patient. It's tricky because it means that someone has to be unwell to be your patient. But at the same time, it's a reality. People are unwell, but where they get the best care is up to you to direct them to you. Thank you.
Thank you for that response, Ms. Chioma. The next question is from Adetola. My question is, as someone who has been in the business of communications but with interest in research, how would you suggest I move to the research side of things? Mr. Chibuike.
I was thinking that would be question for Kehinde because he's the researcher here. Did you want to?
Okay, Mr. Kehinde, would you want to help us here?
Oh, yeah. Yeah, I thought that was great that you pivot towards BK. Thank you. I wanted to piggyback a little bit on the last question about empathy being a soft subject. Empathy is not a soft subject matter that you're doing because you don't want to kind of increase your profit. It's actually what brings the profit. It's actually, if you're thinking about KPI without empathy, especially in health services, because at the end of the day, it's about the story that people take away about you. So for instance, I'll give you a good example. We're asking people to wear a condom so we can prevent infectious disease. You might think that sounds like we're just talking to people, like Chioma gave example of tobacco and what have you. You will be surprised that there are different kind of condoms and there are different kind of sentiment that people have towards, like Magnum, for instance. I did some work on Magnum. I just want to emphasize that it's important for you to understand your audience. It's important for you to understand why empathy is important, to see their point of view. And I give you a case in point here. Some women cannot negotiate condom wearing in their family, maybe because they're not the breadwinners. So that's why you see a family where they have many children, for instance, because the husband does not allow the woman to have a say when it comes to family planning. So these are issues that are beyond. These are issues that are beyond just having a KPI. These are issues that you, as a storyteller or as a marketing director of whatever it is of health service, you have to be aware of such cultural nuances. Because if you are not, you will be sending out messages that are not, that are not addressing the issue for the people. So if you like design all the posters in this world, do all the tweets, if you're not addressing issues that really get at people's heart, especially like Chioma mentioned, we're living in the days of disinformation and misinformation. So it's important so I don't want us to see empathy as, oh, it's such a soft subject that it's not going to help bring, no, it's the center of everything that we're doing. So having said that, on the issue of research, for me, I moved to research because I was curious. I wanted to know why things are the way they are. So if you want to go into research from where you are, I think you have to lead with curiosity. What do you want to study? What are you interested in? And then you must also realize that it's a lonely road. It's not very glamorous. So it's not like, I remember my Coca-Cola days where I would get on a plane to go and shoot a commercial in Cape Town or in Johannesburg because the client had the big budget. In healthcare, no, it's not the same, especially in research side. So if you don't have the curiosity and the passion and the tenacity to be in that space, the issue also is why do you want to switch to research? What are you looking for? But again, like Chibuike also mentioned, I think you should also let people know what you're researching. I think I really learned a lot from that session about you need to publish, your stuff. Don't wait till the end. Like you said, don't wait till the end of your project before you start talking about it. So yes, research is a good place to go, but you have to really be ready for what it takes. The tenacity and the lonely days, the lonely times that you're going to spend. Just getting published or even getting out there with your work. Thank you.
Thank you so much, Mr. Kenny. And then, like I mentioned earlier, I'm also in this webinar to learn, not just to talk. I also have my question, and that's about programming language. Mr. Kehinde mentioned about language, tech language, and all of that. So I have a question about programming language. And then some people have prejudice against using what they call flowery language, like making things look glamorous or something. Can you just speak to that? What sort of tone, what sort of language, what sort of tone should we using in our communication? So I understand that communication, based on what we've had today, in different dimensions. There are people in business, there are people in the NGO, there are people in the research field and all. So what sort of tone should we use when it comes to communicating our messages?
I'm sure that question was not for me. Was it for me?
It's for you, Mr. Kehinde. You were the one who spoke on sentiment words. So,
Yeah. Chioma also did, which was very important. She mentioned some really important points. I think it's important for us to understand that there is no one tone that is applicable to all. I give you a good example of the Australia campaign for road accident, kind of telling people to be careful when they cross the road, and that was one of the most viral campaign ever in the world, which was called "Dumb Way to Die." I'm sure some of you have seen it. "Dumb Way to Die" is very harsh. It's not something you want to put on an empathy level of, because it tells you you're so dumb. Why didn't you see the car coming? Why are you so, it's such a harsh kind of language that you don't want to use for every kind of, but it got the job done. It made people, the same thing with tobacco company, or tobacco anti-smoking campaign, sorry. Many of these are not really exactly so nice. They show you your rotten teeth. They show you, skulls and what have you. And we actually have a name for that in research, the fear factor, that people use to push, So campaign can be push or pull. It can either push you or it can pull you. So you need to choose your strategy. Do you want to pull or do you want to push? The question usually, or the issue most of the time, is to look at all the stakeholders involved. Where are they leaning towards? Where is your, the funder, for instance? If you are being funded by Bill Gates, for instance, they have some certain standard. They have things they want you to say in certain way, the way you address women, for instance. So I think it's important for you, and that's why I put that framework ahead of my conversation. You need to understand the people in this, all the actors, all the stakeholders involved in this campaign. Where are they leaning towards? When we were designing COVID campaign in the United States, we were careful because President Donald Trump at that time, he did not want people to shut down. He did not want to shut down the country because he was leaning toward the extreme right, who didn't want businesses to close, right? And so they never allowed us to use any tone about you need to shut down. We're just telling people, give yourself distance, even though science was telling us people should stay at home. Some other countries were already saying that, but we couldn't say that because of course, stakeholders, the people at the top, they didn't want that to be said. So I don't think you as a storyteller has so much, leverage here or so much power here. It depends on the people you're working with, how they see things and how they want things to be done. So I wouldn't say there is one answer to way your tone of language should be. At the end of the day, it should be human-centered, it should be patient-centered, it should respect the people that you're talking with or talking to. That would be my advice at the end of the day.
Thank you so much, Mr. Kehinde. Thank you so much, Mr. Kehinde. And we've come to the end of today's webinar. Thank you. A big thank you to all our speakers from Ms. Chioma who spoke about the power of healthcare communications, and Mr. Chibuike who gave us insights about budgeting, differentiating between having resources and being resourceful, and then Mr. Kehinde who has spoken so much about empathy and storytelling. And what I want us as attendees to do is to look at ways we can implement all of these informations that we've got from our various healthcare organizations and brands. So if it's the NGO, if the business, hospital, wherever you are, remember to see how to implement and improve on what we've learned today. So thank you so much to our speakers. Thank you so much to the audience. Okay, Aditola is saying she would like to connect the speakers on social media. Yes, you can get them on LinkedIn. If you follow Health and Say on LinkedIn, they're always tagging our speakers, so you can connect with them on LinkedIn. So yes, thank you so much to you, attendees, people that have joined us today. It's been beautiful having you on board. And the recording of this webinar will be made public, so we all have the opportunity to go back and watch and improve and learn from today's session. So thank you so much, everyone that joined, Adetola, Okolala, Dr. Printers, and Mr. Alagboso. Thank you all so much. Okay, Mr. Chibuike also wants to connect on LinkedIn. Okay. Well, I guess we'll carry out or continue the conversation on LinkedIn then. So thank you all so much and have a wonderful, beautiful, and an amazing weekend. Bye, everybody.